Hello, everyone, and welcome to the Henry Schein webinar series on COVID-19. I'm Dr. Gary Severance with Henry Schein. And as always, it's my pleasure to welcome back Dr. David Reznik. Dr. Reznik, thank you again for joining us and making this an incredible year of sharing information on COVID-19.
Welcome, and thank you, Gary, as always, for the kind introduction. It's been some time since we've had a webinar because of the holidays, so I'm glad to be back. And I thought we'd start off with a bit of an update on where we are overall with the epidemic and where it's heading, and then really head into our future and our near future with vaccinations and steps that we need to take. So we're going to go over a lot of material today, and I'm looking forward to presenting it. Regretfully, we have to start off with some sad news. And the sad news is that we are really beginning to see the post-Thanksgiving spike. If you look at the number of total cases and the average daily cases in the United States, over 200,000 cases a day, you can tell that this is really taken a hold. It's been a problem for us since the beginning of the year. The problem is not over, but there is light at the end of the tunnel. As you always know, I want to focus on the positive aspects of what we see. Reality is we are seeing some really huge spikes in cases. This is just a map. Anybody can go to the CDC. You can pull up your own state. You can pull up the United States. This is the first map that they show, and it includes California. And if you've turned on the nose, you know that California is having quite an issue. Their ICUs are getting below 15% of capacity. There's been a surge in cases. You can tell by the purple line. You can look at other areas. You know, the Midwest was hit pretty hard previously, and you can see that Illinois, the cases started to drop down significantly, but now they're ticking up. And basically everywhere around the country, including my own state of Georgia, the cases are beginning to tick up. However, I wanted to make a point about California. The stay-at-home orders that you're seeing on your nightly news, or if you're living if you're in California, do not apply to the provision of dental care and other essential health services. So a point I always like to make is that we are part of primary care. We are a part of the essential services. Patients can come and see you. You can continue to provide care. So leaving home to seek medical care, including dentistry, will be allowed. And please get that information to your patients. Remember, communication is how we keep our patients with us, especially during the trying time we have with COVID. Thought I'd pull up another chart, which I pulled up some different states just to give you a different idea and show you the United States curve. So you can see the number of days since 10 average daily cases, and you can see how the United States is way over the 200,000 mark now, and you can see other states such as California picking up, New York picking up. Every state in the union is picking up at this point, with one exception, and that is Hawaii. If you look at the CDC COVID data tracker, which is available to everyone, you can look over the average daily cases per 100,000 in the last 7 days. So the reason that California doesn't show up as the darkest color, it's because one of our largest states with the most number of people. But again, the capacity to take care of our critical care patients as well as our COVID ICU patients is really putting a strain on our hospitals. I work at one of the largest hospitals in the Southeast, and I can tell you that our ICUs are full. Our critical care areas are full, and we have yet to see the full impact of the Thanksgiving surge of COVID. So we are very concerned. We are taking all the steps possible we can. We are recommending testing whenever possible. We're trying to make sure that people understand this is a disease that impacts everybody. Another part of the sad news that I have to present is the cases and deaths amongst healthcare workers. They looked at over 10 million people, but healthcare personnel was only available for about 2 million, or 20% of the people. For the 252,000 or so cases of COVID-19 amongst healthcare personnel, death status was only available for about 187,000. Cases amongst healthcare personnel, 252,000. Deaths amongst healthcare personnel, our colleagues, our friends, those we work with, are 872. Just people I'm on a board with. One couldn't participate yesterday because she's at home with COVID. Other people I know now are at home with COVID. This has not gone away yet. So what can we do? Well, part of it is we have some good news from the CDC. So let's go back to some news. They have changed their quarantine recommendations. In the new guidance, the CDC said people exposed to COVID-19 who are asymptomatic can quarantine for 10 days as opposed to 14 days. And that's important. So they've shortened the quarantine time for asymptomatic people who are exposed from 14 days to 10 days. And for 7 days if you get a negative test. And I can say that testing capacity, at least in the Atlanta area, is sufficient. Although our hospital is struggling because we have people that we have to test on a regular basis. But the state is doing well. Look at your county resources. See if you can get your test done. Previous guidance that all people that are exposed to an infected person should quarantine for 14 days. The CDC basically has said the goal of the new guidance is to increase compliance with the quarantine protocols and potentially alleviate the economic burden of those who cannot meet 14 days. We do know how this is hitting individuals and families and people. The new guidance came in wake of a 13-1 vote by the CDC's Advisory Committee on Immunization Practices to prioritize healthcare workers and residents in long-term care facilities to receive a COVID-19 vaccine. So we're getting ready to start talking about vaccines. One of the points I want to make to you is that the ACIP, or the Advisory Committee on Immunization Practices, is its own individual body. It's not a government body. It's an advisory body. So when we talk about vaccines and we talk about whether they're safe or they're not safe, realize that in the United States, it goes through the FDA. Then it has to go through the ACIP. It has so many different layers, and the different layers are there to protect you and to protect us. That's the whole concept there. So what are the summary of guidance for public health strategies to address the high levels of community transmission? We do know that vaccines are going to be available, that at the time that the webinar showing, we will have the first one approved in the United States. I expect next week we'll have the second one approved in the United States. But we have limited dosage, and the doses are going to go to people who are most at risk in nursing homes, people who provide direct care, and that does include dentistry. At least in my hospital, we're prioritized because we perform aerosol generating procedures. And although I think we have the greatest technology and the greatest protocols, and we were most prepared for this pandemic than almost any of our colleagues because of our normal standard precautions, we still aren't going to be able to vaccinate a great deal of people. It might take most of the next year to get the majority of people vaccinated. But what we have to understand is that there's a lot of hesitancy about vaccinations. There is a study that we're doing at Grady, not a very formal study, but every employee at Grady was literally given a question. 100% I will take the vaccine. 100% I won't take the vaccine. I'm waiting for more information. And it was divided in a third. A third of the people said they would take the vaccine, and that does include me. A third of the people said no way, and a third of the people were waiting for more information. But as we go through this process, and I hope to give you some information today that will make it easier for you to talk to your patients and to give them the ins and outs of the vaccine process, we really need to look at what steps we can take until the vaccine is available for at least 70% of the population so we can get herd immunity. So what do we know about preventing this disease? We do know that we're at a peak and that it's going to get worse. I hate to say this during the holidays. The COVID-19 pandemic requires a multi-pronged approach of evidence-based strategies, avoiding non-essential indoor spaces, increasing testing, prompt quarantine of exposed persons, safeguarding those at risk for severe illness or death, protecting essential healthcare workers, including our colleagues and our friends, our staff, postponing travel, which is so difficult during the holidays because we all want to be with family, enhancing ventilation and hand hygiene, things that we have been doing in the dental clinic since the beginning of this pandemic, and achieving widespread COVID-19 vaccination. Our public health implications for practice is we need to combine all of these strategies that are shown in this chart so we can try to put off as much of this wave as possible. So now more than ever, it's important that you have eye protection. It's important that you mask when you're in public spaces. Hand hygiene is still incredibly important, and that's something I really don't need to stress to the oral health community because we're constantly washing our hands or sanitizing our hands. We really need to try to avoid indoor spaces and crowded settings. I wanted to go out to eat. I hadn't been out to eat since March. It's not that I'm the worst cook in the world, but I'm also not the best cook in the world. And so I found a restaurant in Atlanta, one of my favorite restaurants, actually, before it turned cold here, that you literally never walked inside. You made your reservation online. You walked outside the restaurant and you ate outside. And the tables were at least 6 feet apart. And so areas like that, outdoor dining is safer. Indoor dining can be a problem and bars can be a problem. So what I do, and I have some wonderful restaurants around where I work and around where I live, I've been doing a lot of takeout. I want to make sure that just like we want people to support our practices, I want to support my community. I don't want to just support things I can do online. So I'm actually using takeout from our local restaurants to help them stay in business. And the same thing for our holiday celebrations, which will be very unusual this year at the program because we have to maintain our distance. Again, increased testing, diagnosis, and isolation are key. Universal use of a face mask, and that is a problem. There are several people in our community that maybe they're tired of it or they're not wearing it properly. I go through the clinic on several occasions during the day, even now more than usual to get my steps in, and I'll see patients who will have the mask on, but it'll be below their nose. I gently ask them, nicely ask them, could you please put your mask up just to protect yourself? And I really haven't had much problem. I think it's just how you go about it. But consistent and correct use, and that's the key. Correct use of face masks is a public health strategy that will help us reduce this next wave, particularly in light of estimates that approximately half of new infections, so almost half of the new infections are not somebody that you know. They're asymptomatic or pre-symptomatic. So it's just all the screening that we're doing is great, but you might miss people because they're asymptomatic or pre-symptomatic. Maintaining physical distance, I am so glad the CDC has changed that from social distance to physical distance. If you've been with us since March, you know that was sort of a pet peeve of mine. Socially, we have to stay in contact with one another. We are social animals. We like talking to people. We like being around people. We deal with the public in the oral health community, so therefore we're used to that. And to do social distancing sort of sounded like you're isolating. Physical distancing, we're just staying a little bit further apart than we would normally do. That's all this is asking for, because we're trying to reduce the exposure to infectious respiratory droplets and aerosols. And as I said before, a lot of times this happens when there's no symptoms. We do want to increase our testing, diagnosis, and isolation. As I just previously mentioned, it's about 50% of all cases are transmission is pre-symptomatic or asymptomatic. And although I know every time I come into this building, I am screened. I am asked the questions, cough, fever, things of that sort. They take my temperature. It's turned into a guessing game for me to try to figure out what my forehead is going to be. Is it 96.9, 97.1, 97.3? But if I'm pre-symptomatic or asymptomatic, that isn't going to work. So just reliance on symptom screening to identify infected people is not good enough. That's why taking the precautions, wearing a level 1 mask when you're in public, wearing your respirator when you're doing your work, and eye protection, so very important, because eye protection is one of the ways that healthcare workers are being infected by not wearing eye protection. Increasing testing is an important strategy to interrupt the silent transmission. So I'm looking forward. I have a grant. I'm waiting to hear back from the grant to see if I can start testing all of the patients, or at least 500 patients who come through my clinic. And so that's one of the things that I'm waiting on now. And hopefully by the time we see each other again in 2021, I will have that grant. Expanding screening tests should be implemented in a manner that promotes health equity. So we not just need to test those that can afford. A lot of testing is free. A lot of the testing in the public health sector is free. So we really want to make sure that those most vulnerable, our elderly, our healthcare workers, our low income, our low resource people, that they're tested as well. We want prompt reporting of testing results. So when dental offices get involved in testing, which I strongly wish that we would do, it's very important that we know the responsibility of reporting both positive and negative results to our states. And so that's a system that we would have to put in place if we're going to be testing in the dental setting. Safeguarding persons at most in risk is so important. To protect those who are at higher risk for severe COVID-19, universal mitigation efforts that I've been talking about are so important. Risk for severe illness, and it's highest for those who are aged 85 and older. So really our grandparents, our elder adults. However, 80% of reported COVID-19 deaths have occurred amongst patients aged 65 or older. I'm getting awfully close to that 65 number, and I work in an aerosol generating procedure. I follow the guidelines, whether I'm here, whether I'm at the grocery store, which is basically the only two stops I make these days. It's home and the grocery store. Long-term care facilities serve older adults and persons with complex medical conditions. So I have patients that are not older adults who are at our long-term care facility. COVID-19 can spread rapidly in these congregate settings, resulting in high rates of morbidity and mortality. A very big long-term care facility in Atlanta recently had an outbreak. It is now under control. So to prevent the introduction and transmission of SARS-CoV-2, these facilities should implement strict infection prevention and control measures and expanding screening and testing of both staff members and residents to rapidly identify and isolate infected people. Regretfully, there was a cluster in an eastern New York nursing home that was traced to one of our colleagues. The Glendale home in New York, a county-funded facility offering short-term rehab and long-term care, reported an outbreak of COVID-19 with 8 residents and 9 employees testing positive. The positive cases were traced to a dental hygienist who visited the facility to provide oral health care to long-term care residents in this 210-bed home. And that's so important that we do provide this care for our long-term care residents. Residents, employees of the Glendale home were then immediately tested. Thus far, residents are experiencing flu-like symptoms and only are sequestered in a COVID-19 quarantine wing of the facility. The dental hygienist did her duty. She alerted the county on November 19th that she had tested positive for COVID-19. So she tested positive, she alerted, they followed their protocols, they isolated, and I'm sure what could have been a much worse incident ended up being a controlled incident. We did our responsibility. Postponing travel. The residency program I work for does not allow travel right now. My hospital does not allow me to travel to meetings or to do lectures, which I'm so blessed to be able to talk to you via these webinars. So travel is restricted. And we have holiday travel. Atlanta has the busiest airport in the world. Our volume for Thanksgiving was 50% reduced, which means that 50% of the busiest airport in the world was moving, and we were moving people around the country. So it's very important that we try to postpone travel. Things that we have done in the dental settings, again, that we've been very proactive about, and we have increased room air ventilation, enhanced hand hygiene, and cleaning and disinfection. These are all important steps. Please follow the CDC and ADA recommendations and guidelines and information that we have covered over the course of this year. Protect essential health workers. Protect each other. We are all essential healthcare workers. And it's not just us. It's not just our medical colleagues. It's our first responders, our EMT personnel, and our grocery store workers. And I was very concerned when I saw a news report that a survey done of the fire department of New York, and they are first responders, only 50% were willing to take the vaccine. So again, these are measures we take while the vaccine is being employed. It's very important because we do know it's going to take quite some time for all of America to become vaccinated, or at least 70% to become vaccinated. widespread availability and use of effective vaccines when they get approved through our system. I trust our system. I have worked with the FDA. I will tell you some of my most difficult times were trying to get a study through the FDA, and they were so tough. On that one case, I was not successful. They really don't just look at what a press release is or a summary is. They look at the detailed data. They pour through it. They look at all of the side effects. They look at all of the different people. And I will tell you now that with all the studies that we've done, we have not looked at vaccines in two very important populations. We have not looked at these vaccines in pregnant women, and we have not looked at these vaccines in children. And so those are studies that will happen later on as we move through. As you know, there are several COVID vaccine candidates that are currently in trial. We have one that is approved by the ACIP. We have the Advisory Committee on Immunization Practices. We have another one that's coming up soon in front of the same committee. And they really will review all of the safety and efficacy data. So whether something is approved in Europe, which is very important to go through their system, they trust their system, and that's very important for the European Union. Russia has something going, but in the United States, we have a system that's been put in place to protect the safety of all medications and how they're going to impact the public. For those who are old enough, you could remember the thalidomide stories, where thalidomide was actually approved for pregnant women for anxiety in Europe and not approved in the United States. And it did cause a problem called phocomelia, which is why thalidomide is not used in pregnant women. So we do trust our system. I do trust the European system, but let's wait and make sure that we have all the data that we need. We have to be transparent in our efforts. We can't hide behind walls. So the data needs to be made available, not just to these committees, but to colleagues of mine who are researching these vaccines, to colleagues of ours around the country that are looking into the data. We need to be critical to obtain the confidence and trust of the public. And that really is a role we need to play. We honestly need to look at what we can do to help inform ourselves so we can inform our patients on how important this vaccine is. Vaccinated people should continue to adhere to all mitigation measures, masking use, physical distancing, hand hygiene, until both doses of the series have been received and the duration of immunity provided by the vaccines has sufficiently been established. For instance, I have antibodies. Well, the antibodies, we don't know how long that they last and how effective that they are. And so we're looking at long-term data. Do we need to give this vaccine annually? Do we need to give this vaccine every other year? So these are still some outstanding questions. But what we're really looking at this point is the safety. So I am going to go over one of the vaccines, one of the mRNA vaccines, just to give you some background on the data. They looked at the primary efficacy of a phase 3 COVE study of mRNA 1273. It involved 30,000 participants, included 196 cases of COVID-19, of which 30 cases were severe. Vaccine efficacy against COVID-19 was 94.1%, which is a remarkably high number and a good number. Vaccine efficacy against severe COVID-19 was 100%. So 100% of the people who received the vaccine, none of them had the severe cases, the deadly cases of COVID-19. mRNA 1273 continues to be well tolerated with no serious safety concerns identified to date. Phase 3 COVE study has exceeded the 2 months of median follow-up post-vaccination as required by the FDA and emergency use authorization. One question that came up in our hospital: can we mandate that everyone be vaccinated for COVID-19 like we mandate flu vaccinations? And the answer to that is under emergency use authorization, you cannot be mandated by a government facility to be vaccinated. So there's no mandate in place because it's only receiving emergency use authorization at the present time. Key points to share. So we really need to understand these mRNA vaccines. And key points to share with our patients, like all vaccines, they've been regularly tested for safety before being authorized for use. But I think something we don't understand is that we've been looking at vaccines against SARS since we had the SARS outbreak 17 years ago in southern China. So we first had that sudden acute respiratory syndrome. I happened to be traveling at the time and doing some international travel at the time, and that was the first time I saw people in space suits basically walk through an airplane and do temperature checks on folks when I landed overseas. mRNA technology is new, but it's not unknown. We've been studying this for more than a decade. So mRNA vaccines, one, do not contain a live virus. You cannot get COVID-19 from taking the vaccine. There is no live virus, so no risk of causing the disease. mRNA from vaccine never enters the nucleus of the cells and does not affect or interact with a person's DNA. So in our health system, they're looking for people to be the example, to be filmed, like you've heard about some of our former presidents wanting to be filmed getting the vaccine. For the infectious disease program, I am going to be the volunteer. I am the one that's going to be vaccinated and filmed. And I'm looking forward to it because I want to show people that it's safe and effective. Presently, at the time I'm recording this, there are no licensed mRNA vaccines in the U.S., but it's going to be happening soon or already has happened. But we had early stage clinical trials years ago on influenza, Zika, rabies, and cytomegalovirus, or CMV, something that I saw in my patients when I started in HIV care in the mid-'80s, that we had a lot of people who lost vision. We had these unresponsive oral ulcers. We had CMV colitis. We had CMV ulcers in perianal area. We would have loved to have had a vaccine at that time, but they weren't ready. But recent technological advancements in RNA biology and chemistry, as well as the delivery system, which is really important, have mitigated the challenges we saw before and improved stability, safety, and effectiveness. They have several benefits compared to other types of vaccines. As I said, there's no use of an infectious element, so there's nothing that can cause you to get COVID. Has shorter manufacturing times, and that's something that I think has caught us a little bit off guard, and I'm going to try to explain that a little bit better. But if you're, again, watching the news, you know we'll have X number of doses, X million of doses before the end of the year, but 1 billion doses in 2021 of this one, 1.1 billion of another one. So it's shorter manufacturing time. And something I like, I'm not someone who likes to get stuck all the time, although I've had 2 vaccines recently for pneumonia and shingles, the potential for targeting multiple diseases with one vaccine. So this process can be standardized and scaled up, making vaccine development faster than traditional methods. So start your conversations with patients early, even before it becomes effective. I'm going to try to convince the readers, the viewers today, that this is a safe and effective step to take, and I hopefully will give you some of the information to help you communicate with your patients. So even before you're able to offer a vaccine, or because I know that some colleagues in Oregon are going to be able to vaccinate, discussions have happened in so many different states about having dentists vaccinate, include this in a topic of conversation with your patients. This will give you the opportunity to set expectations about vaccine availability, when you might recommend a vaccine, et cetera, et cetera. You are one of your patients' most trusted sources of information. Our patients have a high trust value when it comes to the oral health profession. We play a critical role in patients' understanding of the importance of COVID-19 vaccination, as well as if we should recommend it for them. So again, they listen to what we have to say. And so I'm trying to get the information, but the importance is to please stay informed. Through your webinars, through research, through whatever techniques you have to keep up to date with the vaccine, go by the data, go by the evidence-based research. But always start from a place of empathy and understanding. This pandemic has caused extraordinary amounts of stress on people, financially, on personal lives. It's showing up in different ways. You'll see the reports of a 50% increase in people grinding their teeth, and that's definitely related to stress. So the first step to acknowledge is disruption that COVID-19 has caused in our lives, has caused in our patients' lives, has caused in our communities' lives. So we provide an opportunity that we have common concerns. We are healthcare providers, but we're also people with families, with elderly people in our families, with people who might be at risk, etc. Assume the patients will want to be vaccinated, but may not know when to expect it. So I think the expectation of when these vaccines will be available, I think before the end of the year, realize that it is just for us. It's just going to be for frontline healthcare workers, emergency personnel, and the elderly. And these decisions are made at the state level. So limited COVID-19 will be available till the end of this year, but we will have a much greater supply in 2021. Our goal is for everyone to be able to get a COVID-19 vaccine as soon as large quantities are available. Not everyone will be able to get vaccinated right away. So you can sort of say, well, you can watch what happens with frontline workers if they're concerned. You'll get more information. But again, we have to do better with our training of or our information transfer to our frontline healthcare workers, our emergency responders, and our colleagues. It is understandable how concerning it could be for your patients if they cannot be vaccinated right away. There are extremes. There are some that don't want to be vaccinated. There's some that wanted to be vaccinated yesterday. So encourage them to take the proper steps to protect themselves while we're getting a greater productivity out there, and let them know how you plan to share updates. We can share updates with our patients, and I'm doing that on a regular basis with, I'm breaking one of my rules. I do have some paper in the waiting room now that talks about the vaccines. Listen. That's one of the most important things we do. When our patients' mouths aren't wide open and don't have a rubber dam on, listen to what they're telling you and respond to questions they may have. Our willingness to listen makes us special. It's not just our willingness to teach, but it's the empathy, it's the ability to hear what they're saying. And we can, since we already are a trusted source of healthcare, we can make it clear that we understand that there are going to be questions, and I have questions, and that you want to try to answer them when the data becomes available so they can choose when they're going to be vaccinated. Seek to understand what our patients' concerns are and provide information in a way that they understand and that will alleviate the fear if we have that information. And at this point, we have a really good set of information out there. There will be questions about the vaccine safety and speed of vaccine development. So we did not do this in 4 months. We started looking at coronavirus vaccines 17 years ago. We started looking at mRNA vaccine technologies 10 years ago. We were ready to go as soon as the Chinese put down the genomic sequence of SARS-CoV-2. We were ready to start production. So this has actually been a remarkable effort of our government. And I will say that, and this is just a fact, normally we do things in sequential fashion, that we would do a phase 1 trial, a phase 2 trial, phase 3 trial. If it would get authorization, then we would build the manufacturing sites, we would start the productivity, and as you see, this just gets longer and longer and longer and longer and longer. We're in the midst of a global pandemic. So what our taxpayer dollars have done is funded several companies to do the research and at the same time build the infrastructure and start the production of these vaccines, which is why as soon as we get emergency use authorization, you will have 20 million doses available and in 2020 for either or both of the vaccines that are up for authorization this year. So I think sometimes people get nervous when they hear warp speed. They're thinking Star Trek, faster than the speed of light. Well, yes, that's because we've combined multiple steps. And yes, there will be some failures where we have thrown away money. But on the other hand, there will be the successes which will help us successfully navigate and get back to a sense of normality in our lives. This accelerated timeline is unprecedented and has raised some concerns, and that's what I'm trying to talk to. But the safety of vaccines has always been a top concern. And here's an example. Patients may ask, how do we really know if this vaccine is safe? And you could explain it with the language below that the FDA carefully reviews all safety data. And I want to underline all safety data from clinical trials and authorizes emergency vaccine use only when the expected benefits considerably outweigh the potential risks. The Advisory Committee on Immunization Practices that I've mentioned before, a separate body, reviews all safety data before recommending any COVID-19 vaccine use. The FDA and CDC will continue to monitor the safety of this vaccine for years to come to make sure even very rare side effects are identified. So how could we say this? The wording is below. Many people were recruited. We had thousands of people that were recruited into these trials. And we do have a list of what some of the side effects were, such as, a little bit of soreness at the shot area, some muscle weakness, and muscle aches, those kinds of things. But to be frankly honest, they're normal kinds of response. If you do get a minor fever, like when you get a flu vaccine, that's just a sign that your immune system is working and responding, that the vaccine is actually working. Questions about whether it's better to get natural immunity rather than immunity from vaccines, because some people have very mild COVID-19 symptoms. Some may see natural immunity or natural infection as preferable as getting a vaccine. Others may be concerned that getting a COVID-19 vaccine could make a later illness worse. So please help your patients understand the risks and benefits so they can be confident in choosing their vaccine. So they may ask, is the vaccine helpful? I've heard getting a COVID-19 gives you better and longer immunity than protection a vaccine can get. Can it actually make my illness worse? So these are questions. Do I get it? Do I need to get the vaccine because I've had it and I had antibodies at some point? So explain to patients the serious risk of COVID-19 infection. Some people have a very mild disease. Our ICUs are at critical levels right now. Some people get very serious disease. If I had a mild disease and my mother were still alive, God bless her, and I gave this disease to her and she ended up in an ICU, it'd be very hard to deal with the guilt. So I think it's really, truly important that we answer these questions in a way that is safe for all, our family members, our children, our patients. Remind them of the potential for the long-term health consequences of getting COVID-19. About 21% of people who have COVID have long-term symptoms. It's not just over like you've had the flu. Scientists are still learning more about the virus that causes this. SARS-CoV-2 is a new virus. Whether getting COVID-19 will protect against everyone getting again is not known. We don't know how long the antibodies are actually going to work. Describe how the vaccine was tested in these large clinical trials and what's currently known about safety and effectiveness. Be transparent that the vaccine is not a perfect fix. There are no perfect fixes. Patients will still need to practice other precautions like wearing a mask, physical distancing, hand washing, and other hygiene measures until public health officials say it's okay. So it's really time to listen to our public health officials, and this is coming from the CDC. Again, from the CDC, most people do not have serious problems after being vaccinated. We will understand more about mild side effects of COVID-19 vaccine before we start to use it. However, your arm may be sore, red, and warm to the touch. These symptoms usually go away on their own within a week. Some people report getting a headache or fever when getting the vaccine. These side effects are a sign, like I said before, that your immune system is doing exactly what it's supposed to do. It is working and building up protection to the disease. Questions about unknown, serious, long-term side effects. Your patients might ask these questions. Explain how the FDA and CDC are going to monitor safety from now and for a very long time, even for mild side effects. Reassure our patients that COVID-19 vaccines will be continuously monitored for safety after authorization and that the ACIP will take action to address any safety problems not previously known. Compare the potential serious side effects of COVID-19 infection to what's currently known about the safety of the vaccines. How many doses are needed and why? All but one of the COVID-19 vaccines currently under phase 3 or the final clinical trials are two-shot vaccines. The same vaccine brand must be used for both vaccines. Explain that 2 shots are generally needed to provide the best protection against COVID-19 and that the shots are given several weeks apart. The first shot primes the immune system, helping it to recognize the virus, and the second shot strengthens the immune response. And so that's when you're more likely to run a small fever or have the headache or the soreness. I think this is one of the more wonderful slides that I'm showing is that my colleagues and optometrists are seeking permission to administer COVID-19 vaccines. Professional organizations representing dentists and optometrists in California are in talks with state officials to allow healthcare professionals to administer vaccines. Oregon has already begun training and certifying dentists to give vaccines. What a remarkable example for the rest of this country. At least half the states have considered allowing dentists to administer COVID-19 vaccines once they're available, according to the American Association of Dental Boards. And I plan on having a conversation today with the head of the Health and Human Services Committee of the Georgia House Legislature about getting dentists involved in this in my home state today. So with this being said, it's been quite the roller coaster of a year. But I do want to wish everyone happy holidays, a happy new year. I know that 2021 is going to bring us some successes and some challenges, but what a pleasure and honor it has been for me to be able to communicate with you and give you some information through this entire pandemic. So my great thanks to OSAP and Henry Schein for allowing these webinars to move forward. We look forward to your questions. We look forward to continuing this conversation in 2021. And before I turn it over again to Gary, I just want to wish everyone the safest, happiest holidays and for everyone to have a safe and healthy New Year. Thank you, Gary.
Thank you, Dr. Reznik, for that comprehensive overview, as always. And as you mentioned, we echo your sentiments for everybody to have a safe and happy holiday season. This is our final episode in 2020 of the COVID-19 series, but we'll be right back in January 15th, with an update from Dr. David Reznik. Thank you again, and please, if you have any questions, concerns, or ideas for future topics, email us at webinars@henryschein.com. And please subscribe to our YouTube page by clicking the YouTube subscribe button below. Again, thank you, happy holidays to everybody, and we wish you the very best in 2021. Please stay safe and stay informed.